I'm Scott Pritchard, Director of Washington Wellness from the state of Washington. I want to thank IHPM for this award, national recognition, sells well at home. And I specifically want to thank Sean Sullivan, Deborah Love, and Rick Nevins for their support over the last couple of years. Washington Wellness is the health and productivity management program for the state of Washington. We have approximately 140,000 employees, and if you add in retirees and dependents, that's 250,000 people. The largest employer in the state, give or take an airplane. The Healthy Worksite Initiative is a demonstration project that was given to us by the state legislature in 2007. Our essential partner is IHPM, and the focus is learning how to create a culture of health at the agency level. One of the interventions we're using is integrating data from a health survey and health screening that is done on site. We have our first data back, and it's surprising, even shocking. The agencies were very surprised at the extent, the magnitude of the problem within their population, especially those people that were newly identified that didn't know before that they were at risk. We're also introducing a productivity measure, the WLQ. I think this is going to be our most important measure as we move forward. Agencies don't actually have a line item for the medical costs, but productivity is something that is of utmost interest to them. Our larger goal is to integrate health and productivity management principles into the health and healthcare strategy of the state. We want to introduce value-based benefits. We want to focus on health, not just healthcare, and develop a health management system that really does invest in human capital.
Hi, I'm Kathleen Clark. I'm the project manager for the Washington Healthy Worksite Initiative. The focus of this work is agency change. And along with IHPM, we are asking the agencies to answer the following questions. What is the role of the agency in maintaining and improving employee health? What changes does the agency need to make to improve the vitality and productivity of its employees? And finally, how does the agency make these changes to transform its culture into a worksite culture of wellness? The first intervention that the teams accomplished was an integrated health risk assessment and on-site biometric screening. The surprise to the agencies was the high percentage of employees who did not know they were at risk. For example, there were 69% of the employees in the risk pool who did not know they were at risk for diabetes. And there were 74% of the employees in the total number of employees at risk who did not know they had risk for high blood pressure. So the agencies were able to see pretty quickly what their role could be, and that is in taking measures to support employee health and wellness to reduce these risk factors before the employee even needs a healthcare delivery system. We're also working with the senior managers to help them understand the value of a healthy employees. And when they're able to see the benefit to their bottom line or the success of their business, then we hope that they will integrate health and wellness into the business structure, into their strategic plan. Washington Wellness, along with IHPM, are recording all of the successes, all of the tools and the resources that are being created with a plan to spread the successes to our other state agencies.
A final comment. This project would not have been possible without the essential support from IHPM. We're going to have results and be able to sell internally with results, not just from the evidence-based literature. And finally, thanks to all of you in the audience. We're working on this together, and we're learning from each other.